Can I have an S-bar?
Yes. Okay.
Oh, okay.
Hi, I'm Mary. I'm going to give you a report on Mr. Hedding.
Okay.
Okay? So this is Mr. Matthias Hedding, 62-year-old male. Came into the ER yesterday complaining of pain in his right foot and heel. He was admitted and had a wound debridement. Today, he just got back from PACU.
Okay.
He has a history of type 2 diabetes and heart failure. He has an allergy to iodine and he's a full coat.
And he's a full coat. Okay.
Vitals were last taken in the PACU. I haven't had time to take them.
Okay.
Temp is 97.2. Pulse is 92. Respirations 22. He is on 2 liters O2, statting at 94%. Did I give you the blood pressure? 142/94. He is in a lot of pain. He said his pain is a 7 out of 10. He's very anxious. He refused pain medication in the ER and in PACU. He apparently is afraid of becoming an addict.
Oh, okay.
So he's very anxious right now. His last blood glucose was drawn at 11:30. It was 170, and that was treated with 1 unit of insulin per sliding scale. He has an 18-gauge angio in his right AC. Am I going too fast, or are you good?
Not yet.
Okay. And he has half normal saline running at 100 mLs an hour.
Okay. Half normal saline running at
100. He has a dressing to his right foot and heel. It's dry and intact. He's alert and oriented. Heart rate regular. I do hear crackles bilaterally.
Okay.
He's very anxious. His next glucose is before dinner.
Okay.
Labs, he has an elevated WBC,
Okay.
elevated sed rate, and an elevated hemoglobin A1C. His cousin James is in the room.
He's in the room.
One other thing is he has not voided since he got back from PACU.
And what time did he get back from PACU?
He got back at 1:30.
1:30.
Mm-hmm.
1:30. And what time is it now?
It is 2:35.
Okay, I just want to make sure.
Okay. So if you have you don't have any more
I
questions?
actually would like to just reconfirm the vitals with you. I
Sure.
have a temperature of 97.2,
Mm-hmm.
a heart rate of 92 regular,
Yes.
a respiration rate of 22,
Yes.
and an oxygen saturation of 94% on 2 liters.
Mm-hmm.
Blood pressure of 192 over
42.
142
Mm-hmm. Over 94.
over 94. And you said that
Correct.
was taken at the PACU?
Yes.
Okay, perfect.
Mm-hmm.
All right. Thank you so much.
You're welcome.
Do you have any questions?
No.
Okay.
All right, perfect.
Have a great shift.
Thank you.
Thank you.
Bye-bye.
Knock, knock.
Come in.
Hi, how are you doing?
Not so good. My foot really hurts.
Okay, your foot really hurts?
Yes.
Okay, well, my name is Nikki. I'm going to be your nurse. This is Carlos.
My name's Carlos.
Carlos is going to start off by getting some vital signs, and I'm going to do an assessment on you real quick. And that way maybe we can get some pain meds going for you, okay?
Okay. So it's like so much pain.
Like so much
Like,
pain.
it's hard to even take a deep breath. It hurts so bad.
Can you go ahead and verify your name and your date of birth for us?
Yes, it's Matthias Hedding, and I was born August 14th. And I have no allergies. Oh, yes, I have an allergy to iodine. I forgot about that.
Okay, perfect.
Definitely important to know.
All right. Can you rate your pain for me?
Rate the pain?
Yeah, like on a 0 to 10, 10 being the worst pain you've ever been in your life, and 0 being no pain?
It's a 9.
A 9. Okay, perfect.
It hurts really bad.
Is it all right if I sit you up a little bit?
Yes.
Okay. And his oxygen's at 95 right now,
Mhm.
so that's good. I will switch you sides
I'm
so you
gonna
can
take
get in
his
here.
blood pressure.
Okay.
So Nikki, one of those is what is causing the water leak.
Uh-oh, okay.
But just be, so see how it's hanging right here. So just be careful.
Okay, got it. Okay, I'm gonna listen to your lungs real quick. Can you take a few deep breaths for me?
Yes.
Do these mannequins breathe?
Supposed to, but let's just say he's got bilateral practice. So I'm James, the patient's cousin.
Okay.
Why is he in so much pain? Is the anesthesia wearing off, or what's going on?
The anesthesia is wearing off, and so we're gonna get some pain meds for him real quick. We're just gonna do a quick assessment, and then we'll get his pain under control, so he'll be a little more comfortable, okay?
Okay.
So I don't hear lung sounds, and I don't feel chest rise.
So we'll say that you do hear them and you feel it.
Okay, perfect. All
I'm having a
right.
little trouble with
I'm
this.
gonna listen to your heart real
Okay.
quick.
The blood pressure is on the monitor.
Okay.
Having a little technical difficulty.
Should I go with what's on the
I'm
screen?
gonna listen to your
149?
tummy real quick, okay?
Okay. When am I gonna get that pain medicine? That my foot really hurts.
We can go ahead and get that started. Can you check the MAR? I believe he has morphine in the MAR.
Okay,
And get that drawn
definitely.
up? Awesome, thank you. Okay, so Carlos is getting you some pain meds right now.
I don't think I said I wanted morphine.
Well, the doctor did prescribe morphine for your pain.
But
Have you,
I had a friend that was an addict. I don't really want morphine.
okay, have you had it before?
No, but I don't want it.
Okay, why don't you want it?
I've heard about this whole opioid addiction crisis, and I don't want to be a part of it.
I completely understand, and I think it's good that you have that concern, actually. With morphine and any other drug and opioid, you're not going to get addicted to it just by taking it once or twice, especially when you're in the hospital under the care of medical supervision and it's prescribed by a doctor. It's when it's really over a long period of time and you abuse the drug and use it more often than it should be used that there tends to be problems.
So are you sure, I'm the cousin now, are you sure, because James, has a friend that was an addict, and I know that he doesn't really think that narcotics are very good. Are you sure that's true? That he won't be addicted?
It's not 100% sure. It depends on his personality, but right now it's very important that we manage his pain because he just got back from surgery. So in order to promote healing and improve his vital signs, we need to make sure that he's comfortable. And right now he's very uncomfortable, and pain medication is going to help him out right now.
Okay, well, when you put it that way, what do you think, Matthias? Well, I think maybe I'll try it. Okay, thank you.
Okay, perfect. So we'll have Carlos go and get that for you. I'm going to finish up my assessment, okay?
Okay,
How are you breathing right now? How is your breathing?
I'm okay.
Okay, I noticed your oxygen saturation was a little bit low before, but you seem to be bouncing around right now. Do you feel lightheaded or anything?
2 milligrams.
No lightheaded. Mm-mm.
Okay, can you squeeze my fingers for me?
Yes,
Okay, perfect. Can you tell me which finger I'm touching?
yes,
Okay, can you tell me which finger I'm touching?
yes.
Okay. I'm going to take a look at your feet real quick.
Okay.
All right, can you press down on my feet?
Ow,
I'm
ow.
Sorry, we'll be gentle.
Ow.
How about on your
Gosh.
left foot here? Can you pull up for me?
Yes.
Okay. So,
Gee.
I'm sorry. I didn't mean to hurt you.
Okay, well, you better get that morphine going. I decided
2
that.
milligrams per 2
Don't worry, we'll get that
milliliters.
going for you. I'm going to lift your foot up a little bit just so this pillow's not right on your heel where they just did the surgery, okay?
Okay.
So I checked CMS in the upper extremities. I'm checking CMS in the lower extremities. Can you wiggle your toes for me?
Yes, I can.
Okay, perfect. And that's my cap refill and my cap refill.
Okay.
I'm looking at the bandage. It doesn't look soaked through at all.
Okay.
I'm just going to take a peek under real quick and look at your wound real quick, okay?
Okay.
All right, I'll be real gentle, I promise. Okay, good. I'm going to take a look at your heel real quick too. I'm gonna lift your foot up a little bit, all right?
Okay.
You let me know, is that super painful?
Yeah, it's pretty painful.
Okay, well, we'll wait until we get the morphine and then I'm gonna take a look at that one, okay?
Okay, thank you.
You're welcome. And real quick, can you answer a few more questions for me?
Yes.
Can you tell me where you are right now?
I'm at Carson Tahoe Hospital.
Okay, and can you tell me what happened with your foot?
Yes, it has an infection.
Okay, perfect.
And then they took me to surgery and they cleaned it up.
Okay, good, good. How was your lunch today?
My lunch? I didn't have lunch.
You did not have lunch.
No, because I went to surgery.
Oh, I see, okay. Well, let me double check the order. Are you feeling hungry?
Yeah.
Okay, let me check the order and see if the doctor's lifted the MPO, and we'll get some food ordered for you, okay?
Okay.
And then we'll check your blood sugar and give you some insulin to get the food going after we check the order, okay?
Yes, thank you.
Do you have any questions or concerns for me right now?
Nope, I just want to get that medicine now that I've decided to do it.
All right, perfect. And then in the meantime, I am going to turn up your oxygen just a little bit. I'm going to titrate it up. Your oxygen saturations are pretty good, but you're bouncing around a little bit, okay?
Hi guys, I'm back with the morphine for you.
Yay.
So Nikki, he had the order of 2 milligrams ordered, and the dose that I had, if you don't mind verifying, to make sure we're giving him the right dose.
I would love to. Let me check the order.
The bar said 2 milligrams.
Okay.
The vial, I have it right here. It's 2 milligrams per milliliter.
Okay.
So I already loaded with 1
Perfect.
ml. And then I will go ahead and talk to him about the adverse effects and teach him about what to look for. I'm going to also look for patency before I infuse this.
Okay. Let me go grab you a flush so you can check the patency real quick.
Just right there.
Just kidding. There's not.
Thank you.
Okay. And I'm going to check the MAR real quick. He did mention he was hungry. I'm going to see if the doctor took him off the MPO status before surgery.
Okay, Matthias, I'm back. I have that morphine for you.
Okay.
This is going to really help out with your pain. It will help you relax and be a little more comfortable. Okay?
Okay.
Do you have any questions for me?
Knock, knock. Oop, before you start, you forgot your cow outside.
Oh, I don't think
We're just pretending.
Okay.
Yeah.
So third check. This thing is on the right side or the left side? On the left side.
Okay. Can you state your name and date of birth one more time, please?
August Matthias, or Matthias Hedding, August 14th.
Okay. So that wristband matches?
Yes.
Okay.
And your side looks good. It doesn't hurt or anything. Your IV side over here.
No.
Okay. Patient teaching.
So Carlos, let's just simulate rather than push because it.
Yeah, that's what I'm looking.
Yeah.
Okay.
But that's,
Yeah, and then I was gonna check for the patency.
yes.
Okay. So I'm not sure
And did we ever get a temperature for him?
97.2.
97.2, good. Okay. 97.2. Okay. So I'm going to give you this diet here. It's an ADA diet. You can go ahead and choose which items you'd like to order, and then
Would
go
I still
ahead
be
and
able to discontinue this and to check
yeah.
patency and all that? Or would I just do it through this one?
Oh, yeah.
Okay, cool. I hate this one.
Do you need another wipe, or are you good?
I'm good.
Okay. So I'm going to hand you this. Go ahead and choose what you'd like. Have you ever called the kitchen before?
No.
Okay. Go ahead and decide what you'd like. I'll go find your phone. Okay, here's your phone. I'm going to set that right there. The way it works is you're going to dial this number on the bottom when you've decided what you'd like, and just let the kitchen know and they'll send it up, okay?
Okay.
Okay, perfect. In the meantime, I'm going to check your blood sugar real quick. Do that has a blood sugar? Okay, so we'll say that it's good.
Yeah.
Okay, perfect. And you don't need any insulin, so nope, we're good to go on that.
And the line is Peyton.
Okay.
I'm gonna push this over 2 minutes. Do you want me to actually push it, you said, or no, don't push it?
Let's just simulate. Yeah.
Okay. And some adverse effects that you could experience from this is a little bit of drowsiness, some constipation, so maybe a little bit of nausea. So you let me know if you experience any of those, okay?
Okay.
And we can address that right away. So how did the surgery go? Did the doctor talk to you about it yet?
No, I haven't seen the doctor yet. I
Okay.
think it went okay though. It just hurts really bad. But now, ooh, I'm feeling kind of good.
Yeah?
This will help you calm
It
down.
feels kind of warm. I feel a warm sensation going through my body.
Good. Is your pain getting a little better?
Yeah. Whew, I don't really care about it anymore.
Okay. Well, I'm going to take a look at your heel real quick then.
Oh, okay. So we have about 3 more minutes.
Okay. Perfect. All right. How does that feel?
Not too bad.
Okay, good.
Still
good.
really sore, but yikes. Sorry.
Okay. Good. All right. Well, your heel looks good.
Has anyone had a chance to talk to you about your diet?
The other nurse did.
Yeah? What did you guys talk about?
Just what to order.
Okay. As far as managing your condition, do you know what type 2 diabetes is? You've had it for a while now, right?
Gosh, I have to say I don't really care about that right now.
Yeah? You're in too much pain, right?
Yeah.
So we'll,
And I feel good, so
Good.
so I'm done pushing this
I
in
feel a lot better,
20
thank you.
seconds.
Now I just want to go to sleep.
Okay. Can you rate your pain for me real quick before you go to sleep?
About a 3, I guess.
Okay, good. You go ahead and relax, and then from here
Thank
on
you.
out, I keep an eye on his respirations and his O2. Family member, do you have any questions?
No, thank you for taking care of him.
Of course. Get you nice and covered up. And we'll leave. I'm going to put the phone in the menu by your bed
Okay,
here.
stop.